Welcome back to Cheddar's Opening Bell. The U.S. is in the midst of yet another COVID spike. The nation saw 150,000 new cases reported Monday, the most since January. This as Dr. Fauci warns that in winter months, he fears a variant worse than Delta could emerge. Joining us now is Dr. Vincent Roddy, a Miami ER physician and member of the Committee to Protect Healthcare. Dr. Roddy, thank you for being with us. Now, do you agree with Dr. Fauci's assessment? What are you seeing on the ground over in Florida?
We're seeing a bunch of cases. And just real quick, it's actually Dr. Roddy down here in Miami. I'm an emergency medicine physician, frontline provider. I've been, working frontline for the pandemic for the last 18 months, and we're definitely seeing a surge of cases. Unfortunately, what we're seeing right now is actually worse than what we saw last summer. And this is even despite the fact that, we actually have some of the community vaccinated. I think that speaks to the seriousness of the Delta variant and how easily it's transmissible when people don't wear masks. And unfortunately, we're seeing a rise in hospitalizations, both of young and old patients.
Now, Dr. Roddy, forgive me, what needs to be done either at federal, local, or state level to get things under control? Because school, is just weeks away.
I really don't understand the governor's recommendations or decree to not require masks in public places, particularly in schools. We know that masks work. We know that when people are actually wearing masks and socially distancing, that actually does decrease the spread of the virus. And I think that our politicians and local leaders need to stop playing politics and listen to the health experts and do what's best for patients. And that's encouraging vaccinations, and that's encouraging mask wearing.
Now, we know kids can still transmit the virus even if they won't be hospitalized. How important do you feel that vaccine or mask mandates in school will be?
I think it's incredibly important. I mean, right now we're literally seeing a surge that was worse than last year. And this is before, all of the kids are coming back together in school. This is before they're going to be around their teachers. And we have to actually wear masks. If we're not doing that and we're not encouraging social distancing practices and vaccinations, I mean, we could really see a rise in cases even worse than what we're seeing right now. And I just think it's important that the public realize that the Delta variant is highly contagious, that it can be spread more easily than the original version of COVID that was spread around the United States. And, we're going to need a collective effort of the community, of our politicians, our local leaders, of our parents, and of everybody to essentially get ahead of this thing and put a cap on it.
Now, the World Health Organization yesterday called for a delay on third shots, saying that the priority should be to first fix the global imbalance and get people in poorer nations access to the vaccines. Do you agree that sharing the vaccines with less developed nations should be the priority over a third shot?
I do. It's a difficult question. But if you look at what happened in India earlier this year, where they had so many people, they didn't have enough vaccinations, and essentially it led to an overloading of their healthcare system. Poorer nations need vaccinations as well. And if it's a problem in another country, it can easily be a problem in the United States. And the longer that the virus is out there, the more likely that a dangerous variant could mutate and they could threaten our population. So I do think that we need to prioritize getting everyone at least one dose of the vaccination, at least 2 doses, before we're recommending third doses here in the United States.
Now, Moderna said this morning they're recommending a booster shot ahead of the winter. Is this something that would likely be rolled out for everyone or just the immunocompromised?
It really just depends on vaccine availability. Obviously, the more vaccination we have, the more people we can actually immunize. But I would imagine that likely you would probably immunize at-risk populations first, the immunocompromised, the elderly, those that are more likely to have bad outcomes.
Now, we're also seeing southern states grapple with how to respond. Arizona Governor Ducey wants to ban mask mandates like DeSantis in Florida, while another Republican, Asa Hutchinson of Arkansas, wants to undo the ban on mask mandates. Are we seeing politicians walk back their fight on prevention methods because of rising cases and hospitalizations?
We're definitely not. We definitely are seeing, particularly in our state, politicians not following the recommendations of healthcare professionals. I've always been an avid advocate of wearing masks, particularly N95 masks when they're available, to decrease the spread of the virus. Your viewers can take me as an example. I'm a frontline provider, a physician. I have luckily not caught COVID, but that is because I've always had an N95 at my disposal to be used during patient encounters. And at this point, 18 months into the pandemic, I mean, the federal government really should have the ability to send every American in the country an N95. I mean, it's simple. We pay taxes. What are our tax dollars for if not to be used in times of crisis to protect the citizens of this country?
If you could speak directly to a Florida parent who is not vaccinated, who doesn't want their kids to wear masks, if you can give them one message right now to them, what would it be?
The COVID-19 is a real infection that unfortunately I've seen both young and old people become gravely ill. And I would hate to see something happen to you or to your family. And just please listen to the healthcare professionals. I mean, we're here for you, but we want you to do what's right to protect yourself, your family, and then obviously to not overload our healthcare system.
Dr. Vincent Roddy, Miami ER physician and member of the Committee to Protect Healthcare, thank you so much for being with us this morning. Now, coming